Live from the Business RadioX studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
And hello again, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and folks, we are broadcasting from inside Renaissance Bank in beautiful Alpharetta. And if you are looking for a better banking experience for your business, if you've had that big bank KO, that big bank knockout, you know what I mean. If you're with one of the big mega banks, if you like a bank that's big enough to handle all your needs, but small enough to do it in a personal way, I encourage you to check out Renaissance Bank. I know from my own experience that they've got a great way of dealing with their customers, but they're big enough to handle pretty much any need you can throw at them. So go to renaissancebank.com and find their local office near you and give them a call. I think you'll be glad you did. Renaissance Bank, understanding you, member FDIC. And now I want to welcome Dr. Samantha Shams. And Dr. Shams is a medical oncologist with the Piedmont Cancer Institute. Dr. Shams, welcome.
Thank you so much for having me today.
Hey, it's great to have you on. Let's give everyone an introduction to the Piedmont Cancer Institute.
Well, we are a hematology and medical oncology group. We are a private practice that services Atlanta. We have 5 different offices in the north and south sides throughout Atlanta. And we see patients with all hematologic and medical oncology needs, both benign and malignant conditions. We participate in clinical trials and standard of care therapy options for patients. We love servicing Atlanta.
Terrific. Let's give everyone a little background on you. What drew you into medicine and specifically oncology?
Well, I'm from Atlanta, so I have just been delighted and love to be back here practicing in Atlanta. I grew up with a mother who was a talented and gifted teacher. She was always doing the best science fair projects and helping my sister and I do all of those things and throughout school. So I think I was always drawn to the sciences, and that really just continued throughout school and college. And I always knew I wanted to be a doctor. My sister is also a physician. She's an allergist. And I worked with an oncologist in New York City when I was in college. And I loved him. I really loved him. And he's still practicing. He just had this amazing bedside manner, and he was so smart and really just charismatic, and I wanted to be just like him. And I continued and just always thought about him and how smart he was, and how interesting the field of oncology is. It's always changing, and the research and the therapies and how fast paced it is. And I knew that's what I wanted to be involved in, all the things that we can do for patients, drugs and therapies and research. And I always tried to like other fields, and nothing ever sticked. So I just stuck with it, and it turned out really well. I love it.
What is involved for, I want to get right straight to being a woman that's in a field where women are underrepresented. I mean, what's it like to be in that situation, and what did you encounter along the way in that journey?
I think that there are so many more women these days going into the field of medicine. I think that, women account for more and more fields in really throughout a lot of medicine and the medical fields. I think in oncology, women are definitely still underrepresented, but it is getting better in many aspects. Going throughout training, I think each aspect in medicine, you go through medical school, there were definitely a lot of the class was females, but then as you go through in internal medicine, there was a lot of women, but then you go through fellowship, and it became a little bit less and less. And it was a little bit hard sometimes to find some role models, I would say. But I think in every place and every step along the way, you always just find some people that you look up to and you want to kind of model yourself after. And I think that was very helpful for me. I think that also there were a lot of men and, male role models that were cognizant of that were very helpful also. And
sounds like you had one of those.
Yeah. And I think that a lot of us had them too. There was, another one of my mentors in residency. He was also a very important mentor for me. And he helped me a lot, with the research that I was doing at that time. And, just in all those kinds of ways with fellowship applications and all of those things. And I think you just find your people. And I think really for any field, that's very, very important. So.
Yeah, that makes a lot of sense. I want to ask one more question, at least for now, about you. And then we'll get more into Piedmont Cancer Institute specifically, but you're on the board of the Georgia Society of Clinical Oncology. What does that mean for women in oncology?
So, yes, I was very delighted to be selected to be on the board this year. I was nominated by another colleague of mine who's an oncologist in town, Dr. French, and I've known him for a little while through another colleague, and that is, I think, a huge position. And there's a lot of, we call that GASCO, Georgia GASCO, because the American Society of Clinical Oncology is our large network.
Gotcha.
And so it's our Georgia chapter. So I think that's a really big position. There's a number of other women on the board, which is fabulous. And we definitely have like a little crew, I would say. And I think it's great. I think that there was another woman that was selected to be on the board who I had been communicating with throughout about other patients, and I knew her through another friend. And it was nice to kind of be able to now be on this board with her and use her ideas to try and help patients throughout the state, because she's really in a different city. And I think it's a great thing for women, but also for our state and for the community. I never really thought I would have an opportunity like this. And I think it's really great to be able to use the ideas that we have to help patients throughout our state.
Yeah, that sounds terrific. What's the function of this board? Is this a state board? Tell people a little bit more about GASCO.
So it is our state chapter for the American Society of Clinical Oncology.
Right.
And just like the boards of other organizations, we try to help plan or activities. We have our board meeting coming up on the 26th, and the 27th, we also have a meeting that's highlighting all of the highlights that were presented at the national conference earlier this past June.
Gotcha.
Which will be very important for a lot of other oncologists who will be attending. So we do so many different things for patients, all kinds of things from getting clinical trials across the state to getting funding for patients with that don't have funding, just all kinds of activities. Yeah,
I mean, this collaboration is really important for patients. I mean, they don't see all this necessarily, but it's really important for patients.
I think it is very important for patients. It's also important for the oncologists around because, we often have patients, especially for, there are clinical trials all around our state. And sometimes we don't offer the same clinical trials at our institution that other patients have opportunity to have access to at other places. And that's important for us to know. So it's a really important network to have. And so it's great. It's really, really important. The seats are really 2-year positions. And we also interact on a level with the government as well. So there's just a whole lot of policy that goes on. And it's a great way to get to know other people as well.
Yeah. Dr. Samantha Shams is with us, folks. And
Please call me Samantha.
Oh,
Please
okay.
call me Samantha.
Well, thank you. I will do that. Samantha Shams is with us. Samantha Shams, MD, is with us. She is with the Piedmont Cancer Institute. So, Samantha, let's get in more discussion here about the Piedmont Cancer Institute. We need to clear up your relationship with Piedmont Hospital, because I know folks are out there thinking, Piedmont Hospital, not necessarily really the case.
Yeah. So, just like there's a lot of peach trees all around Atlanta. It's kind of similar with Piedmont. We have an affiliation with Piedmont Hospital, but we are our own private entity. We are a private practice. So we own ourselves, and we are a private group, which we love. We can, see patients in all 5 of our offices, and we can get patients in very quickly and just kind of have a very, personal touch to getting patients in quickly, getting them their treatments, and just providing really great care.
Yeah. And I think doctor-owned practices are, let's say the number's declining, right? I mean, because a lot of them are getting, they're getting to a point where they want to retire or whatever, and they're selling their practices. And so this is a little unusual these days, isn't it?
It is very unusual. It is very, very unusual. Yeah. I think that the majority of groups in private practices like this is very small. I think that, pretty much out of all of my contemporaries, I'm probably one of the only ones in a privately owned group like this. But I think there are power in numbers, and we love being in our group. All of my colleagues, all of my partners, we are all very, very good friends. We love working together. We have a great working relationship, and really camaraderie, and we all really just kind of pitch in and take excellent care of patients, our staff, our nurses, our medical assistants, our other nurse practitioners, and we offer a lot of research opportunities, both for our staff to get involved in, but of course our patients, and it's a really, really great place.
Talk about there's a whole lot of conversation and press around the pandemic, and in a lot of ways that's accentuated a problem that existed before the pandemic, which is just the healthcare system getting stretched and the effect on people. And it sounds like you've got a pretty collegial working environment for your team. How do you maintain that?
Yeah, I think like everything, I think the pandemic has been problematic for everything. I think that we've all just really kind of worked together. I think it's really kind of shown that just working together has been very important. The pandemic, especially for our patient population, the oncologic patients, has been particularly stressful. Our patients are typically a very, a population that needs a lot of extra TLC and care, and they come in with, oftentimes a lot of family members, and we want that. We want that, and in a time where a lot of other doctors were able to transition to telehealth and things like that. Most of our patients can't do telehealth because they need infusions and therapies, and we have to give that to them, and we want to control their cancers. So we've had to maintain all of that and still do all those things, even in the early stages of the pandemic when people were not going into work. All our staff members were still there every day, not missing a day of work. And it was stressful, but we did it, and everybody came on with a smile. And it was actually a really great thing to see, I think. And I think it kind of made us stronger, to be honest.
Well, and because you're doctor-owned, this is a question. It sounds like a statement, but it's a question. Because you're doctor-owned, your I guess economic drivers are a little different, shall we say, right? So you're not necessarily on the factory line. You're able to sit and talk with someone that maybe needs a little extra time, right? And that's particularly true in oncology because there's always a whole lot of questions from patients, right?
Yes. I love that I can make and create my own schedule so I can, stop the time and come and talk to you in the middle of the day. And I can, know that if I know I have a patient coming in that I know I need to spend 45 minutes or an hour with, I can block that time. And that's really important because I want to be able to give every patient time that they need for however long that is. I want to be able to come in earlier on certain days and see patients earlier if I need to, or stay later and have nurses there to be able to stay later. We have an infusion center that runs later hours to be able to accommodate patients that need that time, whether they have work commitments. We also open up earlier than a lot of other places to be able to accommodate those times too. And that's really important. That's really, really important.
Talk about the, I guess, what someone that has been, and I know each cancers are different. So, but talk about two patients that have been diagnosed with some sort of cancer and how they should approach that diagnosis and what you say to your patients.
Well, every cancer is different. And I always try to stress to patients that, when they come in to see me, to try to remember that every case is different. And so what they've heard about their friends' cancer or their sisters, brothers, mother's cancer, it's all just going to be different because every cancer is different, and every cancer in the way that it interacts in your body and your immune system, it's just going to be different. And I think it's really important to remember that. The therapies that we have now, this day and age, they're also so different and they're changing so rapidly. And I think that's another thing that just really drew me to oncology. And I don't think I would have expected when I was a sophomore in college wanting to be an oncologist that it would have been the way it is now. The therapies are just dramatically changing. We've got, not only do we have medical oncologists like myself who give therapies, but there's the radiation oncologist and you have the surgical oncologist. But as far as treatments for systemic therapies that I administer, you've got standard chemotherapy options, then you've got immunotherapy options, and you've also got, targeted therapy options. Nowadays, we're offering personalized, therapy options where we're taking patients' tumors and sending them off for specialized molecular testing to kind of target their cancers for specific genes and alterations to kind of personalize our cancer treatments. So kind of getting to meet with an oncologist, formalizing their treatment plan is really the most important step. And sometimes getting a plan it can take a little while. And I think that's the most anxiety-provoking time is really getting to a plan. And so kind of being patient with that and getting a plan in place is very important. But getting it right from the get-go is really kind of the most important thing.
Yeah, because to underline what you just said, different people respond to different treatments, different therapies.
They do. So
it's important for you to kind of get a handle on exactly what the best treatment plan or therapy is going to be, and that takes some time.
It does. And you want to really try and get it right the first time, because that's really the time where it's critical. And before you make a rash decision, you want to try and, cross everything off the list and dot all your I's and cross all your T's.
Again, cancers are different, but how should those of us that have family members, friends, support those loved ones that have some sort of cancer diagnosis?
I think that the supportive thing that friends and family members can do is really just being there and being supportive, and asking the patient or the loved one, what can I do to help? Because I think that we all are trying to act and behave in ways that we would kind of think would be the best thing, but not really knowing that, well, maybe that's not what the other person might want. Right. And so maybe asking like, well, what can I do to help you? Because what somebody else might want might not be what you might want. And so I think that would be probably the most helpful thing.
Terrific. Dr. Samantha Shams is with us, folks. She's a medical oncologist at the Piedmont Cancer Institute. Samantha, I want to talk a little bit about kind of what the future looks like. You have outlined how things are changing so rapidly. I mean, where is this going in terms of, and how it intersects with aging of the population, the growth of different incidences of cancer? I mean, what does the future look like for treatments and therapies in oncology?
I really think that the sky's the limit. I mean, there are so many therapies and drug options that we have today that really weren't even available months ago, 2-3 years ago. We're starting patients on drugs. Even earlier this week, I was recommending a drug therapy for a patient that wasn't available to her even just 6 weeks ago.
Oh, wow. That's moving fast.
It is.
Yeah.
And she's already having a response. And so these are really, really groundbreaking things, and they're huge. They really, really are. So, there's all kinds of opportunities for new therapies and agents. Like I said, there's chemotherapy options, there's targeted therapy options, there's immune therapy options, which kind of use your immune system to kill the cancer, as opposed to standard chemotherapy, which is more so kind of like a bomb that just will kill good cells and bad cells. Utilizing all of these things together, not at the same time, but at different points in somebody's treatment, can also be options. And not everybody has these options. It really just depends upon the type of cancer. Sometimes if they have certain, molecular alterations and targets in their tumor that the doctor decides. So all these things are really important, and the doctor and the patient make these plans together.
And let's circle back around. That's where it's really important to have a great personal relationship with your oncologist.
It is. It is. Yeah, I think that's the most important thing. And, in Atlanta, we have such great oncologic care. We are so lucky to have such great cancer centers around. And we at Piedmont Cancer Institute love serving the community.
So let's talk, as we kind of wind down here, let's talk a little bit about locations and where, because you don't have just one location, you have several.
Yes, we have 5 offices. We have an office in the middle of Atlanta off of Howell Mill, and we just opened a new office in Sandy Springs. And then we have 3 other offices in the South Side in Fayetteville, Newnan, and one in Stockbridge. Awesome. So you can visit our website at www.piedmontcancerinstitute.com.
Terrific. And learn more. Please. Yeah, absolutely. Dr. Samantha Shams, folks, with the Piedmont Cancer Institute. Samantha, Dr. Shams, this has been great.
Thank you so much for having me.
Well, we celebrate you and the great work you and your colleagues are doing. We're delighted to be able to have you on the show.
Thank you so much for having me.
Thank you. Hey, folks, just a quick thought for you. Would you love to plan a team building activity that does not involve the possibility of like broken ankles and mosquito bites? That's the kind of team building activity I would go for, and I've got an idea on where you can find that. It's at ANS Culinary Concepts. Yes, now I realize they do corporate catering, and they've got an award-winning culinary studio, but executive chef Andrew Traub has developed a corporate team building activities there at his culinary studio that are fantastic. And what you do is you stand around a stainless steel table and season meat and cut up vegetables, and you cook together under his direction, and you eat what you cook, and it's a lot of fun. And you will surprise and delight your corporate team if you check that out, and go book something there at ANS Culinary Concepts. 678-336-9196 is the phone number, or go to asculinaryconcepts.com. And just a quick reminder and thank you from us. We're coming up on show number 500 for North Fulton Business Radio. We wouldn't have made it this far without the great support of you, our listeners, and all the business community that we have in the North Fulton region and beyond. So we are grateful to you for that. We got a special show planned for show number 500. So be on the lookout for that. It's coming up here soon. But do us a favor and continue to do what you've done for over these 6+ years. Share the show. If you have found something in this show or any of our shows that you think others could benefit from, we would love it if you would share the show. Well, that's what we're here to do, is celebrate great business leaders like Dr. Samantha Shams and the others that we've had on the show over these past 6+ years. So if you could help us celebrate them, we would appreciate it. So for my guest, Dr. Samantha Shams of the Piedmont Cancer Institute, I'm John Ray. Join us next time here on North Fulton Business Radio.